The night of the accident, you were coming from where?
I was giving Shaun a lift home. We had grabbed dinner together after work.
Did either of you have alcohol with dinner?
I had a beer, and Shaun didn't.
Joni, your tapping is distracting Dr. Park.
I'm okay.
Tap 3 times or bad things will happen. Your shift that day, how long was it? Did you or Dr. Murphy have any difficult surgeries?
Well, nothing unusual. I had an appendectomy, 22-year-old patient, no issues.
Tap 3 times or bad things will happen. Tap 3 times or bad things will happen. Tap 3 times or bad things will happen.
Joni.
Tap 3 times or bad things will happen.
Joni. I'm sure you have more questions for Dr. Park.
You and Dr. Murphy left the restaurant around what time?
A little after 10:30 p.m., we were on Hellier, coming through the wooded section of the park. And between the lane and the turns, I was driving pretty slowly. Good thing, there was a car in the road.
I'm a doctor. My name is Alex Park. I need to examine.
Where's
I need you to
Bob?
hold still. Scalp laceration.
Was there anyone else in the car?
Yes, my brother Bob. He was just driving.
Hello? Bob! I found Bob! He is bleeding from his radial artery. We need to move him! I can't leave her! Okay, Bob.
That's wrong.
What?
You didn't bring him that way.
Oh, yes, I did.
No, you didn't.
Yes, you did.
No, he didn't. You couldn't have. There was a log there. Most people's brains prioritize details, weed out what seems unimportant. My brain doesn't.
Why does it matter what route Shaun took out of the woods? The case
It
is
matters, because if that way was blocked, I must have taken him this way. I would have had to angle the spinal board, which could have caused neurological injury, which could mean my neuro exam was off, which could mean I didn't need to amputate his hand.
This seems like a good time for a break.
Tell me about your decision to amputate the plaintiff's hand.
His breathing became labored, and his pulse was thready. He had no capillary refill. His hand was irreversibly damaged from lack of blood flow. It was leaking toxins that would stop his heart before he reached the hospital. I need to amputate his hand.
The ambulance is 2 minutes away.
But ambulances do not carry amputation kits. There's no time. Once I removed the hand, we traveled safely to the hospital.
That's not quite how I remember it.
The ambulance is 2 minutes away.
I need to amputate his hand. There's no time.
Shaun, it could be a vasospasm. The ambulance is here. They'll have a calcium channel blocker that might restore the blood flow. Shaun, are you sure?
The intra-aortic balloon pump worked. You won't need a new heart.
Great. So, when can I get out of here?
Oh, not for a few days. We will need to monitor you for post-surgical complications. Your heart rate is elevated. Have you been exerting yourself?
She did most of the exerting.
I need 1,000 milligrams of etrasidem and 4 milligrams lorazepam. Stat!
It's probably gonna be okay.
According to your BNP test and echo, your seizure was not related to heart trauma. The EEG will let us assess your brain.
So what's your pitch? Hospital presidents don't supervise EEGs?
I've been very impressed by your Global Engineers Initiative, and I think we can do the same thing with medicine. Train doctors from the developing world to take care of their own people.
What makes St. Bond's the place to do it?
We're very hands-on here. Our residents don't just do appies and lab colis. With the guidance of our attendings, they come up with complex treatment solutions, untangle the thorniest ethical dilemmas, and learn how to provide top-notch patient care. If we could sponsor more residents from the developing world, we'll send them home ready to serve their communities.
But Jared, who I trusted my life, wasn't good enough to be one of those residents. You fired him.
You saw something in him I missed, but I'm seeing it now, and I've granted him full access.
It's a very politic answer. What do you think, Jared? Has he earned my money?
I learned a tremendous amount here at St. Bond's. And as you've experienced, the care is top-notch.
Unfortunately, the food isn't. I'll text Dahlia and ask her to bring us back some of those pork buns from Yang Sing
Dahlia went into the city.
to meet up with friends.
And you're okay with that?
Why wouldn't I be?
No reason. All right. Let's start this. Close your eyes and relax. Shaun, check out the activity in the left frontal lobe from Roland's EEG.
Interrectal spikes. They are very small, likely incidental.
Roland's selfish and possessive. He hates it when people have fun without him, but today he was totally fine with Dahlia hanging out with friends while he's stuck here.
Being unselfish is a symptom.
Maybe one of his wounds got infected. Bacterial encephalitis from the claws or teeth.
This could be subtle edema.
Plus behavioral changes and enterical spikes.
That sounds like neurocysticercosis.
A tapeworm cyst.
With larvae in the brain. But it would take a tapeworm weeks to fully form larvae and a cyst in his brain. The attack was 2 days ago.
Roland's last local safari was about 2 months ago, and he fell into a giant pile of tiger crab.
We can remove the cyst and larva with stereotactic navigation and hydrodissection.
Awesome.
Oh, you're not a failure.
A worm laid eggs in my skull.
Larva.
You were right. Murphy's the best. What would you say to $100 million?
I'd say that's remarkably generous.
You can't accept it. You are not medically fit to be making any major decisions because of the larva.
I closed a huge deal last week with Mr. Worm as my consigliere. I feel pretty competent.
Well, I'd be happy to accept your money after the surgery.
Extracting the cyst and larva.
Awesome. Anti-mite hurl.
Let's close.
Can Dr. Kalu do the closing?
Be my guest.
4-0 Neuroland.
You said you miss being a surgeon. If you complete your residency here, you can do more than closing.
I doubt he wants to go from 5-star restaurants to hospital vending machines.
Actually, someone helped me realize that I love a second chance here.
Chief of Surgery is responsible for all hiring decisions in her department.
I've learned a lot about myself. How to better communicate. How to manage challenging personalities.
I hear Roland can be a handful.
Prepared me for tough patients and tougher attendings. And my surgical skills are still sharp. Andrew's actually let me do Roland's closing.
I'm impressed. Murphy really wants you on his team. That carries weight. But I don't have any openings for third-year residents.
I understand.
But I do have a slot for a first year.